Hi, everybody. This is Lee, and I'm talking about Representative John Conyers, H.R. 676, the Expanded and Improved Medicare for All Act. And I'm being specific about who is actually the author of this bill, which is Representative John Conyers. There is some misunderstanding that I've seen that it's Bernie Sanders who authored this bill. No, it's John Conyers, and that he submitted this bill over and over into the public record since 2003, and then each year subsequently. So it's John Conyers' bill. It's not Bernie Sanders. And that John Conyers is actually the longest serving member of the United States House of Representatives of either party, and that he is actually the dean of the U.S. House of Representatives. That's his position. That he's been a legislator since 1965 at the federal level, and that he has actually authored many other bills. But the one that's getting the most focus now is the Expanded and Improved Medicare for All Act, which is pretty comprehensive for those who take time to read it, even at least the summary of it. And I'll post a link to that in the description. It covers many aspects of what is covered as required care, the placement of private insurers, what their place is in regard to this bill. It describes how this bill is funded. It also describes the possibility of how Indian Affairs will be incorporated, and Veteran Affairs will be incorporated, and then also existing forms of medical coverage, such as Medicaid and Medicare as it is now, children's health also. And so many things are described in this bill. It's, again, very comprehensive. It answers a lot of questions. And people have questioned it, and it seems like they haven't read it. They're just kind of making a lot of assumptions about it. I do recommend actually reading the bill and learning about it, and then also seeing the list of co-sponsors. The fact that a majority of Democrats in the House now are co-sponsors of this bill, meaning that they have gone public with their support of the bill. A majority of the U.S. House Democrats have. It would be nice if all of them did. I am pleased to report that Maxine Waters, one of the longest serving members of the House out in California, that she has co-sponsored the bill. And that even now California is safeguarding its own population by working on a state bill. But I just wanted to make sure to clarify that this bill was authored by John Conyers, that he is a long-standing member of the United States House, that he has authored many legislative bills and has a long body of work, that he is a significant force, that he knows legislation and he understands how things work in Washington and how things are funded. So I'm going to submit that, and hopefully people understand, and that there is a difference between what John Conyers is doing, single payer for all, single payer healthcare, universal health care, extending Medicare for all, taking away the age mandate, folding in all other healthcare forms or packages in order to assist with the funding of the bill. And that this is not the public option that Bernie Sanders has spoken of now and then, that Bernie Sanders has not yet submitted his single payer bill. And so we don't know if he's trying to work on public option, if he's still trying to fix the ACA or protect the insurance companies. What we do know is what John Conyers has submitted, and that 108 members of the United States House have co-sponsored this bill created by John Conyers. So I'll just leave a link to this in the description and maybe some additional information, and people can learn more. But I do think it's important that people see for themselves what the bill is and not make assumptions about what people are telling them that it is. Good luck.